Good evening, everyone, and welcome to the Facebook Live at Global Hospital, Parel, Mumbai. Our today's topic, all you wish to know about hand transplant. And the surgeon that I have with me is the surgeon who's been creating history and milestones year after year, Dr. Nilesh Satbhai. So, welcome on show.
Thank you, Jyoti. Thank you so much.
So, Dr. Nilesh Satbhai really does not need an introduction. We all know last year he had created a milestone by doing the first bilateral hand transplant in Western India, the Monica Mori case. Thereafter, this year, he's gone beyond Western India. This year, he's done the first successful bilateral hand transplant on quadruple amputee patients. Doc, before I start your introduction, let me congratulate you for this tremendous success.
Thank you very much, Jyoti. And at the outset, a very good afternoon to all our viewers. And let us begin the talk.
Sure. So, the introduction of Dr. Nilesh Sadbhai is an internationally trained plastic surgeon with over 15 years of experience in hand and reconstructive microsurgery and cosmetic surgery. He has completed the plastic surgery training from the prestigious G.S. Seth College and KM Hospital, Parel, Mumbai. He then further completed the following fellowships: Fellowship in Hand and Reconstructive Microsurgery at Ganga Medical Center and Hospitals in Coimbatore, then a fellowship in hand surgery, brachial plexus, and peripheral nerve surgery at Ogori Daiichi General Hospital, Japan, and followed by a traveling fellowship in reconstructive microsurgery at Changwon Medical Hospital, Taiwan. He is renowned for his remarkable surgical outcomes that are at par with the international standards. As I repeated, he has created and changed the history of Western India and India today. So, Doc, before I start with the technical questions, I really want to know from you the highlights of your first, the biggest milestone which started last year, the Monica Mori case, which was the first bilateral hand transplant of Western India. Tell me the highlights about it, Doc.
Yeah. So, considering, see, honestly speaking, doing a hand transplant was actually the need of the hour because we have a lot of amputees who have been struggling without any definitive rehabilitative option. And you can only imagine the plight of these amputees, either a unilateral or a bilateral amputee. Uh, uh, they are actually disabled to a very severe extent. They are most often unemployed. They are dependent on their family members for their basic activities and daily course. And hence, they are actually very much in need of a definitive rehabilitative option. Hand transplants have been in vogue for a very long time, but yes, due to the technical complexities and because of the immunosuppressive aspects of the treatment, they are not done that frequently because you need to really choose the right patient and do it in a well controlled manner so as to get the best possible outcome and in a safe manner. So, hand transplant overall have been less in number throughout the world. Regarding Monica's case, yes, we knew about her unfortunate accident in 2014, and it was very much in my mind that we need to start this program and establish this program in the city of Mumbai and in the state of Maharashtra. Because yes, the demand for these surgeries is too much as compared to the organ donations that happen. So specifically, we were preparing very hard for this surgery. We had done a lot of research. We had met the leaders across the world who had performed these kind of surgeries, and we had trained ourselves adequately before we went ahead with this surgery. So it was a challenging process, and yes, of course, the success is always sweet, and as an afterthought, yes, it became a very big milestone for Mumbai, for Maharashtra, and for Western India. But yes, to begin with, and when we were actually working on it, it was never in the mind. The safety of the procedure and the success of the surgery was the prime goal at that point of time.
Yes, and while we see Monica today taking care of patients as a patient care coordinator, this is one of the most beautiful thing I would say. So, Doc, this year you have created a history in India. by doing the first successful bilateral hand transplant on quadruple amputee patients. And then you did one after the another in 15 days too. So, what are the highlights of this? I mean, what is the thing that you can really remember while I talk about this surgery?
Yes, again, quadruple amputation is again a very rare and special situation to be in which typically after a high tension electric accident, the person may lose both his hands and both his feet as well. As we know, for the feet, there are simpler rehabilitative options such as an artificial limb or a prosthetic foot. But for the hand, these options are not viable because an artificial hand cannot really perform to that extent, or it cannot really meet the functional needs and the complex activities that a normal hand can perform. So these patients are again potential candidates for hand transplants. And the main challenging aspect in these patients is that their body physiology is different from a normal bilateral amputee. So after losing both the hands and both the feet, actually there are a lot of physiological and dynamic changes in the body, which makes the management of these patients really difficult and challenging. And that probably has been the reason why there have been previous complications and failures in such cases. So when we encountered our recent two transplants, bilateral transplants in quadruple amputees, it was a huge challenge for us. And as you know, transplant is a multidisciplinary job. So there is a whole team behind it, and managing the post-operative immunosuppression of these patients is a big challenge for the immunologists as well as the intensive care team who made all the efforts to ensure that these patients recovered well in the post-operative period and are now doing well. So it is all a team effort and a team success.
So, I believe Global Hospital Parel Mumbai is the only corporate hospital in India who does the bilateral hand transplants and hand transplants. So kudos to you, Doc, and your team. So moving to my first question, uh, like we heard about hand transplant, but we would like to know in more detail what is a hand transplant.
So yeah, just like any other organ transplant, uh, we commonly know about liver transplant, kidney transplants, and even heart transplants these days. So any person who has a failed organ needs a replacement for that organ, right? So these replacements in some situations, such as in liver and kidney, a live donation is possible because a living person can donate a part of his liver or a kidney to someone who needs it or his relative after a suitable match. But for hands, naturally, a live donation is not possible because everybody needs their own hands. So, after a person is identified as a brain dead person, that person can donate his hands, and these hands can then be attached to an amputee or a person who has lost one or both of his hands. So this, in a broad perspective, is hand transplant. It is the transplant of the hands of a brain dead person to an amputee. So but the beauty of hand transplants is that it is an external organ, and that makes it visible, and that makes it even more exciting to see the body part of a person who is no longer with us to be alive and to be active and to be performing and to make the recipient an independent person, and that makes him really feel complete, and that really rehabilitates him to the best possible extent. So that adds up to the additional beauty of this procedure.
True, Doc. I completely agree with this. I would say other organ transplant are giving a new lease of life. Hand transplant makes you self-reliant and makes you so confident that you start living your life. So, Doc, moving to my next question, are there different types of hand transplants?
Yeah, so different types you mean is different levels of transplant. There are different levels of transplant depending on where is the level of amputation of the recipient. The transplant is done at different levels. So there could be a distal forearm transplant, a mid forearm transplant, a proximal forearm transplant, or an above elbow transplant, which could be a supracondylar transplant or a mid arm transplant. So, depending on the level of amputation, you could label these as different transplants.
Okay. So, Doc, how many hand transplants are performed across the globe? Like, if you
Yeah,
take a figure today, how many are?
yeah. So there is no single registry actually which maintains a record of these transplants. But yes, there is of course an international registry for composite tissue allotransplantation. But the registration of cases on that list is voluntary. So not all cases get reported. But as a broad figure, there are close to 200 hand transplants done in the world till date, most of which were single hand to begin with, but later on there were more of bilateral hand transplants.
So, Doc, this is a very small number, considering the other solid organ transplants. So, Doc, why is it so rare? I mean, what is the reason behind it?
So as I mentioned briefly, because hands are essential to live a good life, but they are not life saving. So not having hands does not threaten the life of any person, or it is not a question of life and death. Hence, the decision to choose a recipient for hand transplant has to be very critically analyzed, and then the decision has to be taken, because every recipient of a transplant has to receive immunosuppression. So immunosuppression, these are medications which alter the immunity of your body, so that your body does not reject the transplanted organ. So these in today's days, the immunosuppression is in the form of three medications, one of which is a steroid. So having to take immunosuppression for lifetime in order to prevent the rejection in these transplants makes the decision making a bit complex. So we have to analyze in terms of the risk and the benefit ratio, or the cost and the benefit analysis of what is the price you're paying to get the hands. So not all patients are candidates for hand transplants. Some of them may not be suitable due to medical comorbidities that they might have, and for social, financial, or any other reasons, they may not be suitable candidates for hand transplants. That is the reason why the recipient has to be very critically analyzed and selected, and hence the overall number of transplants worldwide are less as compared to the other solid organs.
Doctor, even the donation numbers of hand transplant may also be lesser compared to other organs.
Yes. So that is another point at which we are struggling to a very greater extent, because as I said, the beauty of hand transplants is that you can see those hands, but the problem with organ donation or hand donation also is that it is an external donation. So because the mindset of the common man is that you can take anything from inside, let it be liver, kidney, pancreas, intestine, heart, lung, that just leaves a scar on the body without any external deformity of the body. But if you have to take the hands, or you have to actually cause a external mutilation of the body, that is really one thing which makes the donor family really hesitant to take that decision. As a result, the number of hand donations that happen are really very few, and it really needs a very daring and motivated family to take that decision. Not that they don't want to, but the knowledge or the awareness of this procedure itself is quite less, such that when they are in that difficult critical situation, when somebody close to them is about to leave this world, and then suddenly when you are exposed to this idea of hand donation, then such a major decision does not happen in that short time. So I believe that as the awareness for organ donation and hand transplants and hand donation spreads throughout the country, and it touches and sensitizes each and every individual. Every individual should be aware of the existence of such surgeries, or of the need of such surgeries, such that whenever there is a need, or whenever the time comes, they are pre-informed, or they are already informed, they are already knowledgeable about this, and then the decision making becomes more easier. So that, I think, in the long run, is the way out to increase the hand donations, and we are making every effort towards it.
Beautiful. So, Doc, moving to the next question, you spoke about, selection of the candidate for a hand transplant. So, Doc, what are the parameters that you consider while you select a candidate for hand transplant?
Yes. So we need to assess the candidates at multiple levels, and in multiple sessions actually. So first thing is regarding the physical disability. We assess the level of amputation. We assess the severity of the injury. We assess or do some investigations to find out the anatomical structures that decide the feasibility of the transplants. Besides that, the social status of the person, the financial capability of the person, the educational or the maturity of the person, to understand the enormity of this entire process, to understand the importance of lifelong immunosuppression, to understand the responsibility that goes behind making this life changing decision, and behind following the post operative care and precautions, so that they don't have any problems and complications. These, I feel, are very significant and important factors that ensure a long term successful outcome. Besides this, the financial aspects, in my opinion, are important, but they are manageable to a significant extent, because there are a lot of people who are willing to help out. They will come forward to contribute towards the surgical expenses and other expenses. But of course, the ability to have certain financial capability in order to maintain the lifelong expenses is one of the factors. But I feel the intelligence or the maturity of the recipient, in order to understand and take care of himself and of the transplanted hands, is the one which is most important.
Okay. So, Doc, how should a patient prepare if he or she has to, undergo a transplant? So, are there some preparation procedures?
Yes. So first thing is that there are a lot of myths and misconceptions, and we need to inform the patient adequately. So typically, a consultation with a hand transplant patient goes on from for 45 minutes to 1 hour in one session actually, in order to make them understand and explain all these things. So the first step is to consult a doctor, to get all the information, to discuss it with the family, to consider the feasibility of being able to undergo this kind of surgery and being able to sustain this for life. So it is a very major decision in life, and it needs to be thought very well before being taken.
Okay. So, what should a patient expect during the procedure and post procedure, in terms of the results?
Yeah, naturally, the recovery. Now, again, this is the difference between hand and any other solid organ, is that the hands do not start functioning on day one, unlike the liver or kidney, which resume function immediately after they are reperfused. That is, the blood circulation to the organ is restored. So the in hand transplant, the success is in two parts. One is the initial success, which ensures that the blood circulation or the perfusion to the hands is maintained, so that the hands survive and they live. But the long term outcome depends on the nerve recovery and the recovery of the muscle function. So the nerve recovery is a very slow process. It takes a very long time. So typically the nerve growth is said to be at 1 millimeter per day. So depending on what level the patient undergoes a transplant, the that determines how long it is going to take for his hands or the end muscles to function adequately. So they need to be supported with splints for in the initial period, and then they need to undergo supervised physiotherapy for a very long time in order to gain strength of the regained muscles, and in order to also the brain has to adjust, because the every body part has a representation in the brain. So after the transplanted hands start functioning, the patient also has to undergo certain training maneuvers, which helps the brain to accept and cope up with the new situation. So we also counsel the patients and prepare them for this long-term physiotherapy and rehabilitation course. And besides that, they are on immunosuppression, so they need to follow up regularly with the immunologist. They need to undergo certain investigations at repeated intervals in order to ensure that all the systems are functioning well, and there is no side effect being caused by these medications, or any remedial actions can be taken accordingly.
Doc, I can see a streaming question. The person says that he's from Mumbai, and if he has to think of going in for a hand transplant, what is the procedure? Does he need to register somewhere? How is it?
Yeah, so as I said, the first thing is to consult a doctor to assess whether he's the right candidate for transplants. And once all the basic tests and assessments, everything is done, and suppose somebody is deemed fit to undergo a transplant, the procedure is to register himself. So we have a standardized procedure which is controlled by the state government, and we need to fill up a form and register that patient on the waiting list for organ transplants. So we have bodies such as the ZTCC, or the Zonal Transplant Coordination Committee, and the Roto Soto, that is the State Organ Transplant Committee, and the Regional Organ Transplant Committee, which maintain a list of potential recipients. So once a patient gets registered for transplant, his name is on the waiting list, and whenever and wherever a brain dead donor is identified, and the family members are willing to donate their organs, these organs these are again informed to these bodies such as the ZTCC and the Roto Soto, and then the depending on the waiting list and the blood group and the suitability of these patients, the organs are allotted to the respective recipients. Of course, for before undergoing any transplant, there are certain things that we need to match between the donor and the recipient. So this is called as a cross match. So whenever there is an alert for an organ, the donor and the recipient blood have to be cross matched in order to see that there is least discrepancy between them. So this actually reduces the chances of having a rejection episode to a significant extent. And if the cross match test is found to be favorable or suitable, only then we can proceed with the transplant. So this is a
I
very
can
streamlined process.
I can see the patient, the person telling you a big thanks, and he says, "Doctor, you have very well explained me. Thank you."
Thanks.
So, Doc, while I have seen Monica More, I have seen her living almost a normal life today, but I want you to tell the viewers what is the quality of life of a patient after a hand transplant?
Yes. So, yeah, we can also analyze this in quantitative terms, that by measuring the function of different structures and different joints and different parts of the hand. So there are standard questionnaires actually to check this, and worldwide, all studies majorly have reported a very good functional outcomes, or a favorable impact of hand transplants on the quality of life of the recipients. So naturally, a person who is dependent on his family members for most of his daily and basic activities, if that person is going to be able to do these activities on his own, it is going to make a huge impact to his life, right? So and we take many things for granted. We realize the importance of these minor moments, the ability to dress myself, the ability to take care of my personal hygiene, the ability to live an independent life, that actually helps to maintain my self respect, my body image, and all these things are severely affected after somebody has had an amputation. And these all these factors, all these parameters are actually regained and restored uh, when the person is able to live an independent life of his choice in the manner in which he wants, without being dependent on anyone. So that is actually a huge sense of satisfaction that you get after having rehabilitated somebody in that manner. So definitely hand transplants, though as I said that it is not a life saving surgery, but it is a life changing surgery. It is a life enhancing surgery. So that makes it justifiable, especially bilateral hand transplants, because those patients are more severely disabled. So bilateral hand transplants definitely make a very huge impact on the quality of life of that individual.
Oh, yes, quality of life, as I told before, I have seen Monica More and it is so very beautiful. So, Doc, before we end our conversation, what is your message to the viewers today?
Yes, my message to the viewers is that please appreciate what you have got. The hand is a very beautiful instrument that has been created, and we perform all our complex activities based on these hands. These hands are not just for performing our work, but they are used to express our thoughts, emotions, a lot of things. So after the face, it is the hands that we look at in any other person. So human hands are really very special, and they have been designed in a very complex manner, and that really gives it the dexterity, and that is why the human being is at the top of the food chain. So please take very good care of your hands and appreciate what you have got, and at the same time also think about those unfortunate people who have lost their hands for some reason, and please make an effort uh, to be of help to them, and if possible be a part of their rehabilitation. So creating awareness for organ donation is the need of the hour, and we all need to sensitize the entire society, our family, our friends, about organ donation, the importance of hand donation particularly, because it can really give somebody a second chance in life. So that would be my message.
With pride, I mentioned that today our Amchi Mumbai has performed four bilateral hand transplant, of which three has been performed at Global Hospital Parel, Mumbai. That means out of the 19 in India, we have Mumbai has done four. So Amchi Mumbai has to be proud that today Mumbai is becoming the destination of choice for hand transplant. Thank you so much, Doc, for joining with us today in this show, and thanks for all the wonderful discussion we had. Thank you, viewers. Thank you, Doc.
Thank you so much. Have a good day.